Hi there, I'm Dr. Ngozi Onoha, and welcome. This is Health for Niger. So, Health for Niger is an educational platform on social media, and we provide health education content to multicultural audiences and the diaspora community to help bridge knowledge gaps and improve health outcomes. So today I want to talk about seasonal allergies. So we are in the month right now of May going into June, and we are experiencing lots of allergies. If you've gone out and as soon as you step out and walk, you go into a sneezing episode, more than likely you've got seasonal allergies. So why is this happening? Well, when you go out, you probably could see lots of pollen, especially if you're driving, you park your car somewhere and you'll come back and you'll see a whole film of pollen on your car. So what's happening? The trees are blooming and they're releasing all this pollen into the atmosphere. And our immune system is triggered. And then we respond by sneezing, or some people have dry cough or itchy eyes, and nasal congestion can occur. So it's annoying, isn't it? So what can we do about this? Well, there is some basic things that you can do. First, you can get some over-the-counter, either Claritin or Zyrtec or Allegra. You can try that. If that doesn't work and you have symptoms, for instance, at bedtime, and the allergies are affecting your sleep, you could try the Benadryl, which is over the counter. You can take that at bedtime. And you can also get the nose spray over the counter. So nose spray like Flonase or nasal cord, you can get that across the counter, and you can actually speak to your pharmacist to let you know, to tell you what you can get for seasonal allergies. Some people might experience eye irritation from the allergies. They might have itching of the eyes, and you can buy over-the-counter allergy drops as well. And you can speak to the pharmacist and they could tell you what's available. So there's a ton of stuff you can do. And if it doesn't get better, of course, you should definitely see your primary care provider to give you something else that will help you with your symptoms. So just talking about the allergies. We've just started allergy season. Some parts of the country get allergies throughout the year. But here in Philly, we're just experiencing this really robust allergy season. And, some things, again, you can do to reduce your exposure to allergens is you can monitor the pollen count. Just like you check weather, check the pollen count, especially if you're extremely sensitive. Then you want to make sure that you are not going out when the pollen count is extremely high, or you take precautions. So when you're home, keep your windows and doors shut. And during in your car while driving, keep your windows closed during the allergy season. And make sure when you get back home, take a shower, wash your hair so you can get rid of all the pollen that may have accumulated while you were outside. So what else do you need to know? That's pretty much seasonal allergies in a nutshell. If you have really bad allergies, then of course, see your primary care provider, and you can also see an allergist. So an allergist is a specialist who takes care of people who have allergies. And you can find allergists at the teaching hospitals, at the big hospitals. You can schedule appointments with them. And they offer allergy shots. So if you're having problems with allergies that are really bad and you're not responding to the usual prescription medications or over-the-counter medications, then getting allergy shots is another option. So I hope you found this video helpful. If you have, please share with your friends. Thank you. May is High Blood Pressure Education Month. High blood pressure is huge. Lots of people have it, and it is so common a disease, yet people struggle to get it under control. And why is this? Why is there so much resistance to the treatment of high blood pressure? So high blood pressure is the major risk of heart disease. In America, half of Americans who have high blood pressure don't even know they have it. And many people are not aware of what to do for it or how to monitor it. So high blood pressure is something we develop as we get older. Certainly, you were not born with high blood pressure. This is also called hypertension. So when I say high blood pressure and I say hypertension, I mean the same thing. So you were not born with hypertension unless you had some rare congenital condition that you were born with. So some kind of endocrine problem that you were born with. So most people start to develop high blood pressure, hypertension in their 30s. A normal blood pressure is 120/80. So with the number called systolic being on the top and the diastolic being at the bottom. And when blood pressure is elevated for continuous period of time, it can cause damage. So I always say, imagine you have a plumbing system and the pressure goes up in the plumbing system. And there's a sudden gush of pressure in that plumbing system. That plumbing system can actually burst. And that's what happens in our bodies when the blood pressure is elevated. When the blood pressure is elevated, the vessels, the blood vessels are under a lot of strain, and those vessels can burst. Those vessels get damaged, and that damage leads to blockages, and that is what causes so many illnesses that we see that are preventable. So when the blood pressure is elevated, the heart has to do a lot more work. So when that happens, the heart starts to get dilated. It starts to get big because it's trying to do more work. And the bigger it gets, the more it starts to fail. It's called pump failure. And we call that heart failure or congestive heart failure. And congestive heart failure means that the heart is weak and it cannot perform its function of supplying blood throughout the body. So what happens? Blood flow to the kidney is affected. So when the heart cannot work properly, the blood flow to the kidney becomes impaired. The kidneys do not get enough blood to function. So the kidneys start to fail. When the kidneys start to fail, that causes high blood pressure in itself. And that becomes a vicious cycle. The kidneys fail, cause high blood pressure, and that makes the heart more weak. The weak heart cannot supply the kidney, and it goes on and on. It becomes a vicious circle. So the vicious cycle happens, and then that person ends up with kidney failure that progresses, it starts to get worse, and over a period of time, that person goes into full-blown kidney failure and requires dialysis or requires a transplant. And to think all this could have been prevented if the blood pressure had been controlled. So, aside from the kidneys, the brain can get damaged as well from high blood pressure, from many mechanisms. One of the mechanisms is just the pressure going through the brain. It can cause the vessels in the brain to rupture. It can cause damage in the vessels of the brain, and then those vessels start to develop thickening, and eventually it causes blockages. So many organs are affected by high blood pressure or hypertension. Hypertension is easy to treat, and it's easy to treat in the early stages. As high blood pressure develops more, the blood vessels stiffen up, and sometimes it is very hard to control the blood pressure. And a person may need more than one medication, sometimes two, sometimes three, sometimes four, sometimes five medications. By the time that person is taking four or more medications, they have resistant hypertension. And resistant hypertension causes the kidneys to decline much quicker. So, what can we do? We can do a lot to control blood pressure. Number one, taking prescribed medications for blood pressure. Lots of people have prescribed medications, but they don't take it for various reasons. But most of the time, they just forget to take their medications. And there's a simple solution to that. And it's so simple. And I will share it with you. Just set your phone alarm. If you set your phone alarm for a certain time of the day, if you take your medicines twice a day, or three times a day, or once a day, and you set your phone alarm, your phone will go off and remind you to take your medications. It's a very simple but effective way to remember to take medications on a regular basis. And this setting of the phone alarm for medications can be done for other medications, not just for blood pressure medications. So the second thing to do to reduce the blood pressure is exercise. So exercise helps the heart get stronger. When you don't exercise, the heart, which is a muscle, it becomes like flab. It becomes weak. Have you seen someone who's weak just lay in the bed for about a week or two and they lose their muscle strength? It's the same for the heart. If a person doesn't exercise regularly, the heart muscle becomes weak. So exercise can be very simple. It can be a walk, 50-minute walk 2 times a day. It doesn't have to be anything more than that. It can just be a simple walk, something basic. If you like to do other exercise, yes, that is helpful. But if you're not good with exercise, or you have weak bones, or you have other conditions where you can't exercise too much, just walking twice a day for 15 minutes is going to help your heart get stronger. A stronger heart protects you against high blood pressure. The third thing is the diet. The diet is very important. What we eat determines how healthy we are. If we eat a lot of foods that have additives and salt in particular, we are expanding the volume of blood that we have. So the heart has to do more work because salt pulls water with it. And so when you eat a lot of salt, your blood pressure is going to go up. And salt can be hidden. It can be hidden in foods, and it can be also hidden in the different spices that we add, the salad dressings, the cooking cubes. So you got to watch your salt. If you eat out a lot, just know the restaurants, they're making food that is tasty. And often, if you don't add salt to food, it's not tasty. If you go to certain restaurants, they want to sell drinks. So they sell drinks by adding salt to food so you're thirsty and you could buy more drinks. So just be mindful if you eat out a lot, you really have to choose what exactly you're eating because there's a lot of salt in the food out there. Some restaurants, they like to brine the meat in salt. They will brine the chicken, soak the chicken in salt before cooking just to soften it. And that chicken has a lot of salt. So you want to limit your eating out. So learn to prepare some delicious meals where you're not adding salt. So number 4, get a blood pressure machine and check your blood pressure often. So I know it's a nuisance to check blood pressure every day. Not everyone can do it because it's time consuming. But if you have high blood pressure and it's not controlled, you probably should check it every other day or as advised by your healthcare provider. Now, if your pressure is relatively stable, you probably want to check your blood pressure once a day in the morning and write it down. So I'm just sharing some pointers on hypertension and how we can stay healthy. We know in Philadelphia, heart disease is the biggest killer of adults. So people are having strokes and heart attacks because of high blood pressure. So what can we do by ourselves to reduce our risk of heart disease and strokes and kidney failure and vascular disease? There's so much we can do. Go to your doctor regularly, keep your appointments, take medications as prescribed, monitor what you eat, be careful with your food intake, ensure that you're eating adequate amounts of fruits and vegetables, ensure that you are exercising, and you're going back for your checkups. This is important. So that's all for now. What I've shared with you is health education content. It is not medical advice. I hope you found this information helpful. And if you have, please share with your friends. Thank you. The month of May is American Stroke Month. So you've heard me talk about high blood pressure as a risk for stroke. High cholesterol is also a risk for stroke. Elevated blood sugar is also a risk for stroke. So ensuring these conditions are under control is important not to have a stroke. So recognizing the warning signs of a stroke is important because the sooner the stroke is treated, the better the outcome. So signs of a stroke, FAST. We go by the acronym FAST. So is the face drooping, or does one side of the face look awkward? Might look something like this, something like that. Or if you ask the person to smile and they cannot smile, is the smile uneven? Is one side of the face numb? This could be a sign of a stroke. So F is for face drooping. So if you see asymmetry, one side of the face looks different, it could be a stroke. That person should call 911 or go to the nearest emergency room. A is for arm weakness. Is one arm weak or numb? Can the person raise their arms up? Is one arm drifting down? So weakness of the arms could indicate stroke. Is there speech difficulty? Is the person finding difficulty with finding their words, or is the speech slurred or difficult to comprehend or garbled? Person is struggling to speak. That could be a sign of a stroke. So T means it's time to call 911. So when you see signs that might suggest the person is having a stroke, call 911, go to the nearest emergency room. So to go over what I talked about, signs of a stroke, facial droop, one side kind of looks lopsided, maybe like that. Unable to smile, cannot smile. Weakness of the arms, just ask the person to lift their arm up and you may see one side is falling down, one arm is falling down. That could be a sign of a stroke. Or they're having difficulty finding their words, or slow, slurred speech problem. That could be a stroke. There are other signs that could indicate the stroke. Person could have confusion, difficulty with their vision, difficulty walking, or just a severe headache out of the blue. So those could also be a sign of a stroke. Sometimes the person may not have signs and a stroke might be seen on the CAT scan. So it's very important to treat a stroke if it happens, and time is of the essence, because in the hospital, the doctors can give medications to unblock the clot that caused the stroke or to remove the clot that caused the stroke. Strokes can be prevented through healthy lifestyle. And just to know that most of the time, no one can predict when a stroke is going to happen. But there are risk factors that might help, that would help to reduce the risk of stroke. So controlling your diabetes is very important. Controlling your blood pressure. Controlling your cholesterol. If you're someone that likes to eat a lot of junk food, then your cholesterol is going to be elevated. And that elevation in cholesterol can cause blockages in the vessels of the brain and lead to a stroke. So ensuring that you're eating healthy, adding fruits and vegetables to your diet, not eating too much salt. If you're diabetic, not eating sugar. You can eat fruits, but avoiding concentrated sweets and sodas. And also paying attention to your stress. Stress can kill. So reducing your stress, making sure you get enough sleep, 7 to 9 hours of sleep usually is recommended. Getting regular checkups, going for a checkup at least once a year, getting your cholesterol checked, getting your blood sugar checked, getting your blood pressure checked, making sure these 3 things are under control. Try to move. Don't spend too long sitting in meetings. Try to get moving. Sitting is the new smoking, and we know smoking kills. Smoking can cause the blood to form lots of sticky clots that cause blockages. So people who smoke are at risk for heart attacks, strokes, kidney failure, vascular disease, and cancer. Smoking is not good. If you're someone who smokes, look into products like the nicotine patch or the nicotine gum to help you break that habit. Thank you so much for listening. I know I've shared a lot of good information here today. If you found it helpful, please share with your friends. Don't forget to hit the notification bell and subscribe to my channel. Thank you so much and have a wonderful day. Wishing you the best health possible. Bye for now.